Hey, this is Dr. James Nessing, your Macon, Georgia chiropractor. We're here this afternoon with patient Robert. He's a 20-year veteran. He's referred by the Veterans Administration in Dublin, Georgia. We're here doing decompression for his lower back. He's had a history of lower back pain with pain that would radiate down his legs from disc degeneration and nerve impingement. So this is a decompression table. Basically, it's a belt system where this upper torso's stationary. The lower end has no gravity. So when we unlock the table, you can see how the centerpiece opens. So we're going to start the decompression. So one thing about decompression that is different than just static traction is there's a gradual increase of the poundage. With this particular decompression today, our target pressure is 65 pounds. So gradually over 1 minute, the poundage is going to increase to 65. Once it reaches that, it will then drop down to 30 pounds. And the benefit to that is the pressure inside the disc is generally about 40 milligrams of mercury pressure. So when we create the higher poundage of traction, it creates a negative pressure on the inside of the disc, and that can pull a disc herniation. It'll open the spaces for the nerves that go into the legs, and it can be a great benefit to the patient. And then over a period of time, decompression can actually help heal a disc or just improve the back function, facet encroachment, and any of those type of conditions. So if you step forward, you'll see the computer. This is computer controlled. So gradually, very, very slowly, it's already started up to 33 pounds. Now it's at 35. So the benefit to that is if you pull on a tissue too quickly, the proprioceptive sensors of the muscles sense that, and then they go into spasm, or they pull against it. So it doesn't allow the space for the joint to open. So with this, since it's so gradual, the muscles are not part of the equation as far as stopping the traction of the tissue. So now we're at 50 pounds of decompression force. Most of the times the patient will not even notice that there's much pressure. Now, Robert, are you starting to notice anything already, or not that much really?
Starting to notice some now.
Maybe a little bit? Okay. So we're just about to 60 pounds of pressure. So the table's unlocked. We're starting to see this open and separate. So the upper torso is stationary, lower end is where we get the pull. So there's a negative pressure. Now that we're at 65 pounds, there's a negative pressure on the inside of the intervertebral disc. So as an example, a model that we use as a normal, there's the inside of the disc is a nucleus. The rings of cartilage hold that together. And when we have a disc injury, the nucleus can start to seep through the rings of cartilage, and it would look a little bit like this, where you see the disc starting to seep out. So when we create this negative pressure, it'll pull this inward, and then over a period of several sessions, it stimulates the cartilage to scar back over and hold that back in place. Also, it will allow the opening for the nerve that comes out. It actually, when the table's decompression, it actually will open the space up kind of like that. So basically, we're getting 65 pounds, and that's going to let off to 30 pounds. So this pumping effect brings fluid exchange to the disc. The disc does not have a blood supply after the age of like 21. So this actually helps stimulate the healing of that tissue. So at this point, we're about 13 minutes left to go for this decompression treatment. How's that feeling right now, Robert?
Pretty good.
Okay. Can you tell the audience just a little bit how decompression has helped you
It's taken away a lot of the pain.
that you got?
Yeah.
Okay, good. And it's actually helped your leg pain at times, isn't that
Yes,
correct?
it has.
Okay, awesome. So basically, patient's going to be on here for another 13 minutes today, and we're really excited that you came in for your decompression today. And if you have any questions about decompression therapy, don't hesitate to contact us. It's Dr. James Nessing, Dr. Nessing at gmail.com. That's the email address. So thanks for watching.